Hello, everyone, and thank you so much for joining us for week one of BFSG's 2024 summer webinar series. This week, backed by popular demand, Brian MacArthur. I think some of you that have done this over the last couple of years with us, we go back and forth every year, 1 year Social Security, 1 year Medicare. And Brian has been gracious to come back with us for, I think, a third time actually over the last few years. Always one of our most popular sessions during these big webinar series. With that, before I get into housekeeping, let me give it over to Paul and Brian for introductions.
Hi, everyone. My name is Paul Horn. I'm the Director of Financial Planning here with BFSG. I've had the great pleasure of working with Brian now for over 10 years, I believe, for around 10 years. He's a great man and definitely one of the thought leaders in Medicare. So, Brian, I'll let you go ahead and introduce yourself a little bit more.
Excellent. Thank you, Paul. Thank you, Chad. So my name is Brian MacArthur. I run a company called Design My Medicare. We work within the financial services community to help financial advisors demonstrate leadership on the most overlooked part of the financial plan, which is typically Medicare. Most financial advisory firms overlook this for reasons I empathize with, but I always say it's notable when you come across one that does demonstrate leadership on Medicare, and BFSG is a great example of a company that leaves no stone unturned in the financial planning process by making sure that they address topics that other companies don't. So happy to be here.
With that, gentlemen, let me give it back to you to kick this thing off.
I commend anybody on attending a Medicare webinar. It's prior to 64, it's probably not the most interesting topic. As you approach 64, which is a year before you're eligible at 65, it becomes more interesting by force, because at age 64, the whole Medicare industry knows that you are turning 65 and you get more mail than you can possibly imagine. If you have not yet turned 64, I will tell you it's more mail than you can imagine. And a lot of it's fear-based marketing, deadlines, penalties, consequences, which is unfortunate. I suppose it's a marketing tactic, but it's really unnecessary. So we're going to kind of walk through what I call a gentle introduction to Medicare. We're going to cover most, if not all, of the topics on this slide. A few things before we move to the next slide that I just like to impress upon people, or maybe to lay out the agendas. We're going to walk through, like I said, the gentle introduction to Medicare, what it is, what it isn't, what you have to do by when. I always like to start off and let you know when the time comes for you to go on Medicare, whether it's at 65 or later, because perhaps you or a spouse are working past age 65. Medicare is usually good news to great news in virtually every situation. Not everybody knows that, but as Medicare stands today, without flattering myself that I know what will happen tomorrow, as Medicare stands today, it will almost certainly, like 95% chance, be the best health insurance you've ever had. And not everybody knows that, so I like to bring that up. Medicare is also way cheaper in real dollars than any other types of health insurance. I'd like you to take that with a grain of salt, though. If you're self-employed and you're a business owner and you're paying through the nose for health insurance, you know what the real cost to insure one person is on your company plan. No matter what your situation, Medicare will be not only better, but also cheaper than that. A lot of you are employees. Now, one of the benefits of being an employee is that you have a couple $100s a month pulled out of your paycheck, and your employer pays quite a bit more behind closed doors. The only thing you should care about is how much you pay out of your paycheck. So from that standpoint, if you're an employee and you retire, Medicare will still be the best health insurance you've ever had. As far as cost, could be about the same, a little bit less, a little bit more. We'll see. But one, Medicare is good news. So, Paul, I'll have you advance a slide here.
Yeah.
All right. Thank you. And so we'll talk a little bit about what Medicare is, what it isn't, and like I said, what you have to do by when. If we have time on the tail end, I will chat a little bit about the Inflation Reduction Act, which is being fully phased in January 1, 2025, and it is going to provide a lot of pricing disruption. Mostly, I don't want to get ahead of myself, but I'm comfortable speculating that the Inflation Reduction Act will probably create inflation within the Medicare program for most people. There will be some people who benefit, and if we have time to chat about that, we certainly will. So what is Medicare? Medicare's health insurance comes directly from the government. Like I said, best health insurance you'll likely ever have. Out of all the alphabet soup that you see and hear about Medicare, parts A, B, C through X, Y, Z, I'd really encourage you to just think of a full Medicare package as checking 4 boxes. So think of a full Medicare package as part A, part B, part C, part D. I think we can advance the slide here, Paul. There's something who can get Medicare 65 or older. There's isolated cases if you're collecting Social Security disability for 2 years or more under 65, you go on to Medicare. But for the purposes of most people, it's age 65 is when you're first eligible. And if you don't have employer-sponsored health insurance, you go on at 65. If you do have employer-sponsored health insurance from active employment, you can, as long as that employer has over 20 full-time employees, you really don't have to worry about late enrollment penalties. You can stay on your employer plan without consequence until you or your spouse retire. So let's see the next slide, please, Paul.
Yeah, only thing I'll add here is if you are someone that's served in the military, 20 years of service or more, you will qualify for TRICARE for life. So you actually won't be on the Medicare system.
Right. So, yeah, so we're going to come back to this a little bit later. I'll cover it so we can advance to the next slide. Okay, we'll go next slide, please. Okay, here we go. So remember a full Medicare package is checking 4 boxes. Think of it as part A, part B, part C, part D. Next thing I'd like you to do in your mind is draw a line in the sand. Part A and B come from the government. Parts C and D come from insurance companies. Okay, so that's the first line in the sand I'd like you to draw. So A, B, C, D, A and B from the government, C and D from insurance companies. Part A will become your new benefits for inside the hospital. You're not going to use this a lot, God willing, because Chad and Paul and all of us and your family hope that you are not in the hospital very often. But if you're ever lying in a hospital bed, you would incur some Part A expenses. Rather than bore all of you to tears with all the insurance vernacular on what Part A does and does not cover, I would think of Part A this way. Part A basically pays for room and board, food and beverage at the worst resort you've ever been to, okay? So Part A covers the cost of a hospital bed, the 4 walls, the crummy food, the nurses who I hope are nice to you. Unless you're lying in a hospital bed, you will not incur Part A expenses. But if you are, you will, okay? So that's Part A. Part B is how your doctors get paid and everyone who supports your doctors. So essentially all of your medical bills are really Part B bills, okay? So Part B is where all the action or activity or risk is. So when the time comes that you have parts A and B at the same time, which means you're ready to fully go on to Medicare, that's basically, with that Medicare card that comes in the mail, have your name on it, your Medicare number, which will stay the same for the rest of your life, and it'll show Part A and Part B. That card is basically Medicare promising to pay 80% of your medical bills, 80, and none of your meds. So the government gets you pretty far down the road. 80% of your medical bills, none of your meds. And if the government does that for a low monthly premium, which is typically the case, but we will test that theory in just a moment here. That's kind of why no matter what you do for Part C and D, it usually feels like a good deal no matter what, because the government covers so much of the problem, 80% of your medical bills, none of your meds, and for most Americans does not charge you a whole lot to do that, okay? So before we move on to Parts C and D, let's chat about the cost of Parts A and B. So Part A, yeah, we can stay here, I think. Part A has no monthly premium. Now, I would say it's free, but that is terribly unfair to hardworking people like you because you paid for it your whole lives out of your paycheck. And if you're still working, you're going to pay for it out of your next paycheck. So no monthly premium for Part A, okay? Part B will cost the average American $175 per month, okay, per person. But it can and will and does go higher based on your income. So I'm just going to walk through a couple of examples to give you an idea how this works. Paul, did you have something?
Yeah, one thing I wanted to add. So when I made the statement about TRICARE for life, let me better clarify that. If you did serve 20 years, number one, thank you for your service. Number two, you are going to sign up for parts A and B, but as Brian talked about earlier, there's the two separate buckets. You're still going to be on parts A and B, but the other parts are going to be covered by TRICARE. So I didn't explain that very well. I think I need that other second cup of coffee to kick in here.
No, it's okay. Matter of fact, what I would elaborate on that, Paul, is whenever I meet someone who is eligible for TRICARE for life, which is like to your point, different than the VA. If you were in the military for less than 20 years, you have access to the VA. TRICARE is for people 20 years and up, or married to people who had 20 years or up in the military. Now, one of the things I point out as we go into Medicare supplements and things like that, TRICARE for Life is the equivalent of the very best Medicare supplement plan that the veteran and their spouse get without having to pay for it. So normally, where people come to Design My Medicare for a Medicare supplement plan and they have to pay for it, if you have TRICARE for Life, you get the top version for free. From an insurance agent standpoint, I'm always excited for people, but everything's relative. A lot of people who are eligible for TRICARE for Life get a little bit grumpy because prior to 65, they pay very little for TRICARE. Prior to 65, TRICARE is paying for 100% of your medical bills. Well, once you turn 65, you need to enroll in A and B. And as we're about to cover, you're going to pay at least $175 for Part B. From an insurance agent standpoint, I always say, hey, this is great. You don't have to pay for the supplemental insurance. The TRICARE for Life recipient is also a little bit grumpy because they say, well, this stinks. I have to pay $175 to keep my insurance. So, it's all relative. But yeah, good point. So Part B, the average American pays $175 a month, but it can go higher based on your income. So I'm just going to walk through a couple of examples here, and I'm going to stay on kind of the bookends. I'm going to go on the lowest premium and the highest premium and how you get there or how you stay there. So the government, whenever you're ready to fully go on to Medicare, the government is always looking at your tax return from 2 calendar years ago. Now they're looking at your modified adjusted gross income, which no human being on earth has memorized. So as you're thinking about this in your head, just shoot from the hip. It'll be sufficient for now. So let's just say somebody was going on Medicare, August 1st, 2024. So they're going on Medicare in 2024. The government's going to look at that person's 2022 tax return. Okay. And every year it's going to reset automatically. In 2025, they're automatically going to look at your 2023 tax return. 2026, they'll automatically look at 2024. You get the idea. Resets automatically. So if someone in 2024 was going on to Medicare, they'd look at the 2022 tax return. And if that person had a modified adjusted gross income under 103,000 as a single filer or under 206,000 as a joint filer, they'd say, okay, you and your spouse, if your spouse is eligible for Medicare, you'll each pay the minimum Part B premium of $175 a month. Okay. So for a married couple, even people who are really good savers, like clients at BFSG, because you kind of need to be a good saver to be a client of, Chad and Paul's and the teams. A lot of people, as a married couple, 206,000 is, a fair amount of money. So if your income is under 103 single or 206 joint, you'll pay the minimum Part B premium of $175 a month. So that's a long way of saying, if that was your situation, you just got 80% of your health insurance covered by Parts A and B for $175 a month. Well, what if your income was higher? So other things that happen sometimes with some of you is, one, your income's higher, or two, your income is maybe below 206,000 as a couple, but you work a lot of years. Usually your highest income year is at the end of your career. You may need to exercise stock options upon the departure of your company. Maybe you need to turn on deferred compensation. Maybe you sell a rental property, things like that. We call these liquidity events. So a big pile of money gets dropped in your lap one time, and let's just assume it's taxable. That would obviously spike your income. So what would happen if your income was higher? Well, let's just say you were going on Medicare at age in 2024, and we looked back, or we don't look back. The government looks back at your income in 2022, and maybe that was the year that you retired, and your income as a couple was $500,000. Okay, never going to happen again, but there was a liquidity event that spiked your income in that year. Well, 2 years later, let's say now in 2024, the government's going to say, hey, you earned $500,000 as a couple, where the average American pays $175 a month for Part B. You're going to pay about $635 a month, quite a bit more than $175, right? And that is per person. Good news, bad news. The bad news is it's a big, ugly bill. The good news is, again, that resets every year. So if you did nothing, next year in 2025, they'd look at your 2023 taxable income, and maybe that was lower. 2026, they look at 2024. So eventually that liquidity event would not trap you into those higher premiums forever, but certainly for your Part B premiums, 2 years in the future. What's most common, though, is that you get these big liquidity events and then your income settles. So what I would bring up is that for a lot of you, even if you've got a deep 7 or even 8-figure net worth, you've got this big liquidity event. 2 years later, the government tries to charge you $635 for Part B, and you say, hey, we don't make that much anymore. There's a form you can fill out. And Social Security Administration, which is who you deal with to enroll in Medicare, is very reasonable. And there's a form called SSA 44. So like Social Security Administration, SSA 44, where you would fill that out and declare a life-changing event. Essentially what you're saying is, hey, please stop looking at our income from 2 years ago. We don't make that much anymore. We had a life-changing event, which is almost always work stoppage. And then you'd make a good faith estimate for what you think your current modified adjusted gross income will be. So to give you an example, again, let's just say you're going on Medicare in 2024, your income as a couple was over 500,000. That'll never happen again, but it happened in 2022. You get that big ugly invoice. You fill out form SSA 44. You say, please stop looking at our income from 2022. We had a life-changing event. One of us stopped working. This is what we think we'll earn in 2024. Let's just say it's under 206,000. Social Security Administration is very reasonable about allowing you to appeal your way out of those higher Part B premiums. The real term is called IRMA premiums, IRMAA. And it's really broken down with, I'm just giving you guys the big number. Everybody pays 175. There's a Part B like Bravo IRMA premium and a Part D like Delta IRMA premium. I'm just adding it all together and telling you it's $635 in this example. But what you would do with form SSA 44 is appeal out of your Part B and D IRMA premiums back down to your minimum Part B premium of $175 a month. So yet an even longer way to say could be $175 a month minimum to get 80% of your health insurance covered by the government. Some of you might pay more if your income will never get down too low, but a lot of you will have these big lumpy liquidity events that you're going to appeal your way out. So for most people, let's just assume $175 for Part B. Can we move to Go ahead, Paul.
Sorry, real quick here. Yeah, so a couple real life stories with clients. We had one client that sold a cabin that created that large liquidity event. We helped them with this. They were able to get it reduced down to the minimum. We had another client with there was an executive with some stock options, a one-time deal. Again, same thing. They were able to get it done. So it's not a guarantee that it's going to reduce, but as Brian has said, the SSA, the Social Security Administration, is very agreeable, to these sort of things. If it makes rational sense, they tend to err on the side of common sense. So that's great to see. And just a little housekeeping item. I know some people are trying to raise their hand. Again, we can't unmute lines. So if you do have any questions, please post them in our question and the Q&A box, which you'll find on the bottom of the screen. And we're trying to make sure that we answer those questions. A lot of questions have been coming through on the Part B premiums, how that IRMA is calculated. If you are married, it's based on your joint income. It's based on the income of both of you. And if your income is somewhere between that 206 and the 500 marks that Brian gave, well, there's step ups. And so you're going to be paying a little bit more than just that base premium, depending on where your income falls within that range.
Excellent. Yeah, and I just turned on the chat box, so we'll cover a lot of these questions probably closer to the end, but I just want to acknowledge that I see these questions coming in. So, so that's pretty much what the government does and what they charge you for it. So Paul, if we can move on to the next slide. So remember, I cheat a little bit in how I explain this. There's no consequence to the way I cheat. I just am always looking to turn complicated topics into something simple. And I cannot resist the temptation to alphabetize. So remember, we called a full Medicare package Part A, B, C, and D. A and B was from the government. We just covered that. 80% of your medical bills, none of your meds, will cost most people $175 a month. Could certainly be more due to your income dynamics. And now we'll talk about C and D. Here's where I'm cheating. I'm going to say that Part C and D will always come from insurance companies. Whatever you do for Part C, imagine an insurance company paying the other 20% of your medical bills. So remember, Parts A and B from the government paid 80%. So Part C is an insurance company paying the other 20%. And anytime you hear Part D, still an insurance company, but just think D is for drugs. Okay. So here's where I'm cheating. There's a fork in the road. There's two ways to skin the cat from a Medicare insurance standpoint. It is not good versus evil. Either option will be the best health insurance you've ever had. But I think what Paul and I always appreciate about working together is that neither of us are utopians. All right. There is no utopia. There's trade-offs. And even though both are very good news, we want to understand the trade-offs so that you understand you can make a judgment on what's better for you. Here's where I'm cheating. I'm going to call both sides Part C and D. Really, one side C and D, the other one's called Supplement and D. There's no harm in just thinking two different paths to C and D. So if you hear me deviate a little bit and call Medicare Supplement Part C, I'm just trying to keep it alphabetized. Okay. So I'd like you to imagine that fork in the road as we see here. Two different ways to address Part C and D. Okay. Maybe not all of you, but a lot of you, if you allow me to generalize, a lot of BFSG clients come to us, they're already used to PPO plans. So I'll probably speak more in the context of PPO plans. There are HMO options. I'm going to say most people who are on a PPO usually want to stay on a PPO because they like the flexibility. So I'm going to speak in the context of PPOs a little bit more than HMOs. Just to say, maybe a third time, that anything you do on Medicare will probably feel like the best PPO you've ever had. So there's two ways to skin this cat. There's Medicare Supplement, which is option one. This will be what I'm going to call one path to Part C and D, and there's Medicare Advantage, which is the other path to C and D. And we'll go through both. Medicare Supplement plans, once again, be the best PPO you've ever had. These have monthly premiums. Medicare Advantage plans, also typically the best PPO you've ever had. They often have no monthly premiums. So we'll go through both here. Medicare Supplement. With Medicare Supplement, it feels just like a PPO. It does not say the word PPO on it, but as I describe it, you'll say, feels like my PPO. You do not need a referral when you're on a Medicare Supplement plan. So just like any PPO, you can go see any doctor in the country without a referral, because that's what PPOs allow you to do. Some of the uniqueness of a Medicare Supplement plan, which when the time comes, you'll decide, is this worth paying for? And the answer is, I don't know. That's why we lay out the trade-offs, and you've got plenty of time to think about this. But Medicare Supplement plans, which have a monthly premium, not only do they not require you to have a referral like a PPO, but they also have no networks. Well, when there's no network, there's no chance of you going out of network. And if you have a PPO, you know that if you go out of network, you pay more. So you typically try to stay in network where you pay less. You still have the autonomy to go anywhere you want, but most people with a PPO try to stay in network because it's cheaper. And most PPO plans have a pretty gigantic network, so it's pretty easy to stay in network. But with Medicare Supplement, no network, therefore no cost difference between doctors, which really means you could be asleep at the wheel and go wherever you'd like. You don't need a referral, and you'll never get some big surprise bill. So you keep all the doctors you know and love with a Medicare Supplement plan. And if you need a second opinion across town, out of the county, out of state, it's just fine. You go anywhere you want in the country. If the best left toe orthopedist for you is in Albuquerque, go to Albuquerque, okay? Because 100% chance you can see that doctor, 0% chance it'll cost any less than the left toe orthopedist at your local medical group. So, I have had people go to Mayo Clinic and things like that with a Medicare Supplement. So in that way, it's even a little bit more flexible than a PPO, which to date has been the most flexible thing that you've had because there's no networks. So that's one of the dynamics of a Medicare supplement that you'd say, is that worth paying for? The top version of a Medicare supplement plan, I'm not pushing you here or anywhere. I'm just setting this as a bookend. I'd like you to think of this as robust an option as it gets and as expensive as it gets, but it's not the only option.
It's
So
the Cadillac.
Oh, right. Thank you. The top version of a Medicare supplement plan, regardless of the insurance company, is called Plan G. I'm going to call it Plan Great to get away from the letters for a moment, because if I start talking to you about Plan G to address Part C, our heads will explode, or at least mine will, explaining it to you that way. So that's one of the consequences of me cheating, I suppose. So Plan Great. What does life feel like on Plan Great? Well, you already know. You can go see any doctor in the country. No referrals, no networks. We covered that. You would have an annual deductible of a whopping $240 per year, 240. What that really means is that the first $240 in medical bills that you incur each calendar year, you will pay for. Once you've paid that $240th, you have met your deductible. And after that moment, unless your doctor or hospital charges for parking, you could go to the doctor or hospital without your wallet for the rest of the year. That is literally what life feels like on Plan G or Plan Great with a Medicare supplement plan. Okay. So without you having to be a health insurance expert, you can start to gather that this is good news, right? So big dramatic buildup. How much do Medicare supplement Plan Gs or Plan Greats cost? The answer is it depends, but across most parts of the country, I would say age 65, a Plan G or Plan Greats probably depends on the market. It could be $140 to $160 a month in most markets. So let's split the difference, say about $150. Some areas of the country are more expensive. Minnesota is almost double that. Parts of Florida are 50 to 75% more than that. There could be a couple states I'm missing, but if I lined up all the states, it's about $150 a month for Medicare supplement Plan Great. It does creep up every year that you have a birthday, so you anticipate that. In addition, staying with option one, if you did a Medicare supplement plan, you'd also need to buy a separate Part D drug plan. As a placeholder in 2024, I'll tell you that the average sustainable monthly premium on a Part D drug plan is about $30 a month, 30. But it is a wacky business, folks. As we sit here today, there's plans that are 50 cents a month. There's plans that are $150 a month. It's a weird business because cheap does not mean it's a bad plan for you, and expensive does not necessarily mean it's a good plan for you. My staff and I, we care about monthly premiums, as do our clients. What we really care about is monthly premiums plus the copays on the medications you're taking, because we want to focus on the real dollars that are going to come out of your pocket over the calendar year. So as we sit here in 2024, if you were taking notes, I would write down about $30 a month for Part D. The Inflation Reduction Act, which phases in January 1, 2025, is probably going to double that. I'll talk about that if we have time. But for right now, it's $30 a month. So just recap where we are. We've got $0 for Part A, $175 for Part B for most Americans, $150 a month for to check the Part C box. We use Plan Great Medicare supplements are up to $325 a month. Let's throw 30 for the drug plan, $355 a month. That would be a good example of as good as it gets, as expensive as it gets on the Medicare supplement side, not the only option. Okay. So obviously, what could change that? Well, if you want dental and vision, that costs a little bit extra. And of course, if your income's higher and we cannot appeal that down, that could drive that up. But for most Americans, Medicare supplement Plan Great with a Part D drug plan, throw in the Part B premium under $400 a month. So that's what life would feel like on a Medicare supplement plan. Okay. Now, what we're going to do is we're going to go back up to that fork in the road. We're going to travel down the only other path to Part C and D. And this is what they really call Part C and D. It's called Medicare Advantage. The first thing you'd notice about Medicare Advantage is that almost always these have no monthly premium. Again, the government's involved, so it's a little bit of a wacky business. No monthly premium does not mean it's crummy coverage in the least. These plans would still easily be the best PPO you've ever had. So we'll go through what life feels like in a Medicare Advantage plan. And then once we do that, I'm going to cover a couple of other things. And then we'll kind of talk, because some of you are going to work past age 65. So I do see some questions of, what do I have to do or not do if I'm going to stay working past 65? And we'll certainly cover that and plenty of other questions. So with Medicare Advantage, no monthly premium. I'll explain why it's no monthly premium in a moment. The government's paying the insurance company. They pay them very well, which is why you'll see it's still very good coverage. So no monthly premium. When I say no monthly premium, you're still paying $175 a month for Part B, but you're paying zero for C, zero for D per month. So very often your total monthly cost on Medicare Advantage is $175 a month, which is just your Part B premium. Could be higher based on your income. So typical PPO Medicare Advantage plan, no monthly premium, no deductible, which very few people have no deductible these days under age 65. Very modest fixed dollar copays. Probably all the copays are probably still less than you pay currently. Primary care doctor could be $0, could be $20. To see a specialist could be, $20, maybe $40. It's a real PPO, so you can go out of network and you just pay a little bit more to see an out-of-network specialist. Not a big deal. Most of the time you try not to do that, but you could. Labs are often zero. Diagnostic tests and procedures could be zero, could be $40. An MRI could be $110 to $250. Most emergency rooms, usually $120. A lot of very predictable fixed dollar flat fee copays, so you really don't have to worry about another shoe dropping or the other shoe to drop. Most Medicare Advantage plans, just like your current PPO plan, have an annual out-of-pocket maximum. It totally depends on the county and the state, but to paint a broad brush, most plans have an annual out-of-pocket maximum of $4,000 to $6,000. What's different between a Medicare Advantage PPO plan and your current PPO plan is that on your current PPO plan, you could probably find a couple different ways to get a $6,000 bill. It's very difficult to get a $6,000 bill on a Medicare Advantage plan because the coverage is so good and there's no deductible. I find the only way to really hit a max out-of-pocket limit, for the most part, on a Medicare Advantage plan is usually chemo, radiation, or dialysis. Other than that, it's almost impossible to get a bill that big, and there are supplemental insurance policies that you can buy to that pay you money. God forbid you're hospitalized or diagnosed with cancer, that don't cost a whole lot of money. So if you were worried about having to stomach a four-figure bill, which is unlikely with Medicare Advantage, but could happen, chemo, radiation, or dialysis, there is insurance that you could hedge on that as well. Drug coverage is built into a Medicare Advantage plan. That's just to say you're buying one policy on this side to check the Part C box and the Part D box. Additionally, Medicare on its own does not cover dental and vision and podiatry and hearing aids. And of course, there's insurance policies that we can go out and shop to find those things. Medicare Advantage plans often include a lot of those benefits. I know it's weird that the one with no monthly premium includes extra benefits, and I'll explain why that is, but pretty much any Medicare Advantage plan will include enough of a vision benefit that you should resist the temptation to buy vision insurance, because the best vision insurance and the best day kind of stinks anyway. So just take what they give you and be grateful. You might even get a dental benefit built into your Medicare Advantage plan. That dental benefit might be a little bit better than nothing, could be robust enough that you don't need extra insurance. If it's somewhere in between, you can always pay a little bit extra to get a more robust dental benefit. So as you can see so far, whether you go one path to C and D or the other, it's all good news, okay? One charges you a monthly premium, and other than your $240 deductible, you pretty much never see a bill. The other one, you have no monthly premium, and you're just paying modest copays as you go, and it's still probably better than any PPO you've ever had. So all good news. I will point out that when the time comes for you to go onto Medicare, if you want Medicare Advantage, you got it. There's never any qualifying questions to go to Medicare Advantage. If you're on a plan this year and there's a better plan next year, you just move to that during the open enrollment season in the fall, and then your new plan starts January 1. Medicare supplement plans, back to the one with the monthly premium. Those normally love to ask you health questions so they can accept you or decline you. But if you're brand new to Medicare Part B, which you will be once you turn 65 or later, if you stay on your employer plan and then go on to Medicare later, you'll have a one-time guaranteed acceptance into the Medicare supplement. So there's a little bit of a bird in the hand dynamic worth weighing. If you do Medicare supplement Advantage immediately, you'll probably love it just fine because, again, best PPO you've ever had. People don't call me that often to go over to Medicare supplement, but if you did, and it was a couple years later, we'd probably have to answer health questions. They're not the worst health questions ever, but insurance companies don't want to step in front of moving traffic either. And they could accept you or decline you. Now, so that's just a dynamic to keep in mind. That decision of whether to do Medicare supplement and take that bird in the hand used to be more polarizing. For a long time, all Medicare Advantage plans were HMOs. They were magnificent HMOs, but if you're on a PPO, you usually don't want an HMO. And if you did an HMO and then you found, oh, I don't like having referrals, or I want to go to whatever specialist I want, and then you wanted to go over to Medicare supplement and they declined you, you might have felt trapped in an HMO for the rest of your life. That's untenable to most of you. Now that the Medicare Advantage PPO lineups are so robust, fewer people buy the supplement. Most people say, you know, I can afford it, but why am I paying a monthly premium if I can have this Medicare Advantage plan with no monthly premium? So it's all good news either way. My job would be easier if one was a hero, one was a villain, but it's good news on both sides. You just want to understand the trade-offs, and whatever feels best to you is what you should do. So that's a dynamic just worth kind of pointing out. I'm doing way more talking and not enough listening here, Paul. So I'm open to some questions if you are.
We got a lot of questions coming in. We got over 30 questions so far. So let's just keep going. We'll address them at the end.
Okay, excellent. So yeah, so ultimately, let's advance this slide or two. So Medicare costs, we covered that. Let's keep going, please. Okay, and this is kind of a very similar slide. It just happens to show the A, B, C, and D on it, right? So A and B is on the left. That's 80% of your medical bills, none of your meds. And option one or option two is that fork in the road that we talked about. So we covered that pretty well. One of the other things I'll bring up, and I'm not trying to drive the bus here, but I usually bring this up anyway. And I did see that Norna Cash had asked this question anyway. A lot of, look, 65 is not old anymore, okay? And a lot of you are going to work until it stops being fun, or you feel, you know, that it's time to retire. So a lot of you might be approaching age 65 and you go, I'm not going to retire, you know, I don't know when I'm going to retire. It's certainly not going to be at 65. So in most cases, not all, but the overwhelming majority of the cases, we usually, it's often people say, well, I'm going on Medicare. One, a lot of people don't know Medicare is as good news as it is. But they go, well, you know, do I have to? Most people know you don't have to go on Medicare if you have employer coverage. And that is true. As long as your employer has more than 20 full-time eligible employees, you can stay on your employer plan without consequence. Typically around age 65, we do a little bit of poking around and we just say, hey, how much is your employer pulling out of your paycheck? If you can get a summary of benefits on the plan that you're on, if it's decent coverage and your employer doesn't charge you a whole lot, most of the time we just say stay on the employer plan. If you have crummy coverage and your employer charges you a lot, you might be thrilled to go on to Medicare at age 65 and just jump off the employer plan. That's usually not what we conclude, but I want to acknowledge possibility as well as probability. But let's just assume Norna has decent coverage. Her employer doesn't take a lot out of her paycheck. She said, Brian, I just, you know, I don't want to disrupt anything. I'm probably just going to stay on the employer plan, which is what we would probably suggest most of the time. Norna's next question is, okay, Brian, aren't I supposed to do something at age 65? So, and this will probably, this will probably apply to, I'm going to guess about 50 to 60% of you. So yes, even if you're going to stay on your employer plan, you're supposed to enroll in Medicare Part A at age 65. Now, remember, Part A has no monthly premium, so you're happy to do it. It doesn't just covers hospitalization benefits. So if you're not in the hospital a lot, it just kind of floats around behind your employer sponsored coverage. Now, look, if you were ever hospitalized before your current insurance plan offered through your employer paid the hospital bill, they'd say, hey, this person has Part A. Let's see how much of the bill we can get Part A to pay. It'll certainly save your insurance company money, may or may not translate to save money for you, but it costs you nothing. And you're supposed to do it. There's no late enrollment penalty for not enrolling in Part A, but you're kind of being a good Boy Scout or Girl Scout by enrolling in Part A. Okay, so that's what you're supposed to do. It's very easy to do. You just need to have a username and password to ssa.gov, and typically my team just hops on a call with you once you schedule an appointment and we have you log into your account. It takes about 7 or 8 minutes to apply for Part A. About 3 weeks later, you get your Medicare card in the mail with your name on it, your Medicare number. It'll stay the same for the rest of your life. And Part A, report it to your employer. Nobody's going to throw you a party, but they'll make a note that you have Part A just in case you're ever hospitalized. So that's what you're supposed to do. The only reason not to enroll in Part A at age 65 is if you are currently in a high deductible plan and contributing to a health savings account. Now, some people who have higher income as W-2 employees don't get nearly as many write-offs as maybe a self-employed person. So if you have high income, you're used to getting clobbered in taxes. You probably max your 401k, fund IRAs if you're eligible. And most people in that situation are pretty enthusiastic about putting money into a health savings account because as long as you use it for health related expenses or qualifying health related expenses. An HSA, correct me if I'm wrong, Paul, is probably the most favorable taxed investment in the country.
Nothing beats it, hands down. Yeah. And HSAs can be used to cover future costs on Medicare.
Right. So typically, if you're in that situation, you're usually pretty darn enthusiastic about that HSA account. Well, if you signed up for Part A and you told your employer, like you're supposed to, they would say, hey, you can't make HSA contributions anymore. So for people like that turning 65 who have a high deductible plan contributing to an HSA, I usually tell you to do nothing because you probably don't want to stop contributing to that HSA account. And again, there's no late enrollment penalty, so we can kick the can down the road and sign you up for Part A when we do B and C and D whenever you're going to retire. So that's a very common question. So that's my answer to that. And I'll pass it on to you, Paul, and let you quarterback the next. So when can you enroll? Boy, all the mail you get at age 64, you probably see the text that we're about to share on the inside of your eyelids at night. So when you're turning 65, everything with Medicare starts first of the month. So if you're turning 65 August 10th, Medicare, you're eligible to start Medicare August 1. Your initial election period when you're turning 65 is 3 months before your birthday month. So that would be what? May, June, July. The month of, which would be August, and then the 3 months after, September, October, November. Really, nobody's doing it the month of or the 3 months after. Everybody does it 3 months earlier in almost all cases. But it's a 3-month window. You don't need the full 3 months. The quicker you do it, the quicker that thing, the more unrushed the whole process is. But I just want to let you know, if you had an August birthday and you didn't, sign up for A and B and apply on May 1st and you did it on June 1st, it would be fine. July 1st would be fine. Under that gets a little bit tight, but it would be fine. But you have a 90-day window, which is plenty of time, is my point. Additionally, for those of you who are going to work past age 65, let's assume you enroll in Part A, even if you don't. But, in a lot of cases, a lot of you would have Part A. You work for another 2 or 3 years, and then you say, Brian, I'm ready to retire. I need Medicare to start, November 1. I'd say, okay, well, we can start that process 90 days prior, all right, which would be anytime after August 1. And then we would show you how to apply for Part B, and they would add Part B to your Part A. Or if you were doing an HSA, we'd apply for A and B together. And then once you have A and B, then at that point, we're ready to make a decision on Medicare Supplement or Medicare Advantage. So that's that. We can move on to the next slide. Okay. Yeah, probably the next slide will show the calendar.
Yeah.
So open enrollment season every year. There are exceptions to this, but I don't want to bore you to tears with those. If you call us outside of this window, we're usually looking to say if there's something that needs to be done to improve your situation, we're just asking ourselves, do we need to wait till the annual enrollment period, which is October 15th or December 7th, or are there special enrollment periods we could use? But assuming no special enrollment periods, when can you change your Medicare plans? It's October 15th to December 7th. And that's the time to, make any changes for the upcoming year if any changes are appropriate.
Yeah, and if you're scared about if once you've enrolled, if you're scared about you want to make changes and you're scared you're going to miss this window, when your mailbox starts getting full of all those flyers reminding you about upcoming changes, you'll know it's time to call someone to make those changes.
Right. Yeah. And I
Pretty hard to miss.
Right. And I will point out, not to hit things too close to home for Paul here, but outside of the annual enrollment period, they have special enrollment periods. So again, if you were losing coverage from an employer, you have a special enrollment period. Also, my goodness, lately we have a lot of weather-related special enrollment periods. So Paul literally had a wildfire almost knock on his door, I think, within the last 18 months. I hope that's not oversharing, Paul. But, we live in Southern California and all over the country. Sometimes, if there's any type of weather, heavy flooding, wildfires, mudslide. I think I even saw there was a special enrollment period. Forgive me for not knowing, when Jimmy Carter's wife died. This is how insane this stuff is getting, but that Medicare issued a special enrollment period to change your Medicare plan if the death of Mrs. Carter affected your ability to change your plan between October 15th and December 7th. I'm not trying to laugh at the fact that she passed away, but lately there's just a lot of special election periods. So, the moment people have needs, they bring them to us, and then we just let them know, hey, do you need to be grateful for what you have because this is the way Medicare works, or is there an opportunity to improve it? And if there is an opportunity to improve it, is there a special election period where we can do it now, or do we need to wait until AEP, which is October 15th, December 7th? And we can go to the next slide. I think we're getting towards the end. Yeah, I think I probably, okay. Yeah, we can skip that one. Okay. So, anyway, as helpful as I hope, my contributions, or effort to contribute were today, I always let people know Medicare.gov, as government agency websites go, is actually pretty decent. I mean, nothing's perfect, but there's information there. So, you can always do that. Everything that we do at Design by Medicare is designed to we have a very agnostic process that we're always just trying to guide you through this to, and make sure that any interaction you have with us feels like an extension of Paul's and Chad's financial planning process. So we make every effort to be neutral and agnostic. But that being said, it's important to know you can go to Medicare.gov, you can call 1-800-Medicare. The website on its own is pretty decent. I think calling Medicare, not to say that you're probably going to wait on hold, and I would see what you could accomplish on the website first. But if you don't want to do any of those things, of course, we're available as well. And then just keep in mind that even though you hear Medicare, 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 you're applying for Medicare through the Social Security Administration. So those benefits really have nothing to do with each other. Applying for Medicare does not trigger you turning on Social Security. They are independent decisions, but you are applying for either Social Security or Medicare through the Social Security Administration.
Thanks, Paul. Thanks, Brian. First, when would I need to stop contributing to an HSA to enroll in Medicare? There's another one on, my spouse has an HSA. Can she still continue to contribute if I enroll in Medicare? Let's start with those, and I'll kind of filter through and see if there's other ones that'll address that.
Yeah, good questions. And is it okay, Paul, if I?
Yeah, go ahead.
Okay, great. So, So yeah, typically what I would tell somebody is, hey, keep contributing to the HSA because you're probably pretty enthusiastic about it. And we'll just do part A when we do part B and C and D later, right? Now that being said, and I appreciate that question because I didn't cover that when I laid this out. When you the cleanest way to do this, if you're going to continue on an employer-sponsored plan, not on part A because you want to fund that HSA account, um, is to stop if you feel comfortable on predicting your retirement date, stop contributing to the HSA 6 months or more prior to you needing to go on Medicare. And here's why. If you were 65 now and I said, don't do part A, keep doing the HSA, get money in there, save the money on taxes, everything like that. Let's say you called me 2 years later and say, okay, I'm ready to go on to Medicare. Well, we'd apply for A and B first. And if you said, I need, Brian, I need part B to start July 1 of 2026. Well, part B would start July 1, 2026, and your supplement or advantage plan would start July 1, 2026. Part A, even though you're going to apply for a July 1, 2026, they're actually going to give you a retroactive start date back 6 months to like January 1, 2026. Not a big deal because Part A doesn't cost you anything, but what it would do is overlap with your HSA contributions. And there is an overfunding penalty. I'm going to be, you call honest, vulnerable, ignorant, whatever you want to call it. I'm not even positive who would catch and calculate the penalty. I don't even know how well it policed that it is, but it'd be irresponsible for me to ignore the fact that there is an overfunding penalty. It's not going to change your life, but most people don't want to pay penalties. So the best thing you could do is keep contributing to the HSA. Once you feel like you're within 6 months of retirement, let's just call it 7 to give you a little bit of grace. Everybody I know with an HSA is able to just pre-fund it like any given month. There's an annual maximum, but I would just get as much as you can in maybe at 7 months before retirement so that you're not contributing anything in those last 6 months. That would be the cleanest way to do it. Look, if you wound up with some overfunding penalties, it's not the biggest deal in the world, but most people want to avoid penalties. The other question is, which is maybe better to answer, is it's not employers can continue to contribute to your HSA if that's part of your benefits without consequence. This doesn't affect employer contributions to an HSA. It affects employee contributions. So, if your spouse is contributing to an HSA and you had part A, what happens sometimes, people apply for part A and they don't tell their employer. And then the employer keeps letting you contribute to the HSA, which is creating that overlap and penalty exposure. But if you have part A, the best thing to do is report it to your employer or your spouse's employer, because if you do that and they say, hey, if your spouse has part A, we can't contribute to the HSA, then you're going to know, okay, I should unwind the part A enrollment. And there's a form to do that. But yeah, it still applies even if it's your spouse contributing in their employer
In their
sponsored
HSA plan.
HSA. Yeah.
Yeah.
So now the next one we have group is, and there's a lot of upvotes for this. Does Medicare A and B cover you if you're out of the country? Maybe go beyond that. If like you might be traveling out of the country, but what if you moved out of the country? Maybe cover both.
Yeah, it's not really sufficient for, like an expatriate type situation. Now, if you have a Medicare Advantage plan and there's no monthly premium, you just leave it in place. If you were, moving out of the country indefinitely, well, let me answer the question the best way.
Yeah.
Medicare supplement plans, all Medicare supplement plans like Plan G, do have an international hospitalization benefit. Medicare Advantage plans don't have to have them, but almost all of them do at this point. So I'll walk through what life is like on both of those. What's constant between the two products and how they handle this, Medicare Supplement, Medicare Advantage, is that if you are hospitalized overseas, the expectation is that you are going to pay the hospital bill, and then you'll submit it to your insurance company for reimbursement. Okay, so that's constant on both sides. I'll also share with you, that's kind of constant on both sides. Maybe foolish to say this on a recorded Zoom. I can't put this in writing. I can't promise it, but I have heard third-party stories from representatives of the insurance companies that we deal with who've said, hey, if it's an extended hospital stay and there's time to call the insurance company, there have been cases where the insurance company says, you know what, have the hospital direct bill us and we'll just leave you out of having to pay the money and then call Paul Horn from Europe to get wire $40,000 or something like that. I'm going to go out on a limb and say there's a better chance of that direct billing happening in London. If you're going kayaking in Zimbabwe and you're bitten by an alligator, like you're probably going to have to lay out the money and they get reimbursed, right? But the language in all of the documents says you pay the money and then the insurance company reimburses you. What do they reimburse you? On the Medicare supplement side, they'd reimburse you 80% of your bill, which is not bad, less a $250 deductible. So if you had a $10,000 hospital bill, you pay the bill, you submit it to United Healthcare, Blue Shield, whoever. They give you back $8,000 less the deductible of $250. So you got $77.50 back on a $10,000 unexpected bill on vacation. Not bad. So it's not nothing. I definitely have people that travel just with that. There's certainly more robust things that you could buy. Medicare Advantage, same thing. You're supposed to lay out the bill and get reimbursed. Typically the way those work, as long as they cover, emergency rooms, so it's not for regular scheduled doctor's visits. It's, going into an emergency room, that you submit the bill to them and they just say, hey, had that happened if you were in Orange County or Miami or wherever you live, this is what your copay would have been. You went into the ER, you got an MRI, you spent 2 days in the hospital. Maybe the copays would have been $900. You give them a bill for $10,000, you get, $9,100 back. So like I said, it's not nothing. But there's other things you could buy for, lost luggage and lodging and, that sort of thing. But the baseline benefit is pretty meaningful, I think.
Yeah, I mean, for planning for clients that are moving abroad, this is something we've done in the past. Typically, the recommendation that we give is most of the time, and this really depends, like Brian said, where you're going to, especially if you're going to be moving there permanently. It's best to keep your coverage here because, Brian said, if you have the Advantage plans, those can cost you nothing, but you still have the coverage here. And then you're probably going to need to look at getting either, if you're traveling, get some sort of travel insurance as another layer of protection. It's pretty cost effective. Or if you're going to be relocating there, learn their system. If you become a citizen, you might qualify for free healthcare in that country. Otherwise, you may need to look at getting insurance once you get there as well. I do have some stories of clients that have moved abroad. Something's happened, like cancer, and then they come back to the US for treatment. So you want to keep that US turned on as long as you're a US citizen, just in case you need to come back for extended treatment.
Right. That's a great point, Paul. And I should mention that the explanation I just gave for what the Medicare plans will do is really designed for the first 60 days of a trip. So it's not really an expat solution. So if you're going to be, like we have a client that lives in San Diego and France, and I have a couple clients and they spend about 6 months in each area. And it does depend. Like one couple's in Austria, they get free healthcare there, right? But when they come this way, they use their Medicare benefits. But anything beyond 60 days, I'm going to say your Medicare plan's not really designed to do that. And that's all great insight. There's Facebook groups for every darn thing imaginable. Certainly people Americans moving to Austria or Switzerland or Portugal or whatever. If an insurance policy made sense, I have a colleague that I outsource that to just because he lives and breathes that vernacular all day long. And I'd rather humble myself to honor my own expertise and also honor his. So, we have a resource if people did need, a longer term international health plan solution.
Thanks, gentlemen. Next one we have here is, I've heard that once you go to Medicare Advantage, you cannot go back to regular Medicare. Is that accurate?
So no, it's not accurate. But it's a fair question. So again,
Paul, you stop sharing your screen, by the
I'm
way.
sharing. I know. I'm trying to get back to that slide.
okay. Um, there you go. So no, if you do Medicare Advantage, you can do that. You just have to know that, look, if you're brand new to Part B, if you did Medicare, original Medicare with a Medicare supplement, immediately you get a guaranteed acceptance into the supplement. Okay. If you do Medicare Advantage to start, again, if that serves your needs, it'll probably be great. But if you ever called me and said, I want to go to Medicare supplement, let's say a couple of years later, you 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 just have to answer the health questions. They're not the worst health questions ever, but insurance companies don't want to step in front of moving traffic. If they could spot that you've got a big bill coming, might pass on you. That dynamic used to be way more polarizing. I'd mentioned when Medicare Advantage plans were all HMOs, which a lot of them were to start. It was like zero premium HMO or pay this monthly premium for the Medicare supplement. That felt was the only thing that felt like a PPO. So it was very polarizing. Now that the Medicare Advantage plans are, there's just so many PPO plans, those two plans feel way more similar. So it's not quite as like red pill, blue pill as it used to be. But definitely, if you did a Medicare Advantage plan to start and you wanted to go to Medicare supplement later, which is original Medicare with a Medicare supplement, you'd have to answer health questions. If you can navigate the health questions, then you get the Medicare supplement. If not, you have to stay in Medicare Advantage. If that Medicare Advantage is a PPO, you're not going to be thrilled if you wanted to go to supplement and they declined you, but it's not the biggest deal because you still have what's probably the best PPO you've ever had. It was a much bigger deal when the Medicare Advantage plans were all HMOs because then you might feel trapped in an HMO.
So the next one, and this is specific to probably a handful of groups, but we do have a lot of doctors groups on here. Are physicians able to opt out of Medicare coverage?
Like, yes. However, there's a difference between possibility and probability. I find I'm speaking from experience. So if somebody on here says, no, Brian's wrong, call me out on it. I'm happy to be proven wrong. But in general, what I have observed is whether it's a, MD, medical doctor, chiropractor, dentist, pretty much when you go through your formal education and your licensing, every provider in the country basically starts off as a Medicare provider. Now, look, use dental as an example. A typical dentist might be a Medicare provider. They've never collected a dollar from Medicare because Medicare basically doesn't pay for dental, barring like very, very specific circumstances. Essentially, Medicare doesn't pay for dental. But, um, gosh, high 90% of providers are Medicare providers because their licensing kind of starts them off that way. And my best understanding is it actually takes a bit of effort to opt out of being a Medicare provider. So is it possible? Yes. Is it
Likely, no.
probable? No. I guess another way just to elaborate on that, on Medicare supplement, where I said, hey, you can go to any doctor in the country. You can go to any doctor in the country who accepts original Medicare, which is 98% of doctors. The largest portion of the 2% who do not, and I know that people are chiming in from all over the country, so this geographically might be relevant to some and not others. But in Southern California and, Oregon, Washington, Arizona, Kaiser Permanente it's like the quintessential HMO. Kaiser Permanente does not take Medicare supplement plans. You have to have their own Medicare Advantage plan. So the biggest, with a Medicare supplement, original Medicare, you can see 98% of doctors in the country, the biggest portion of the 2% who you cannot are at Kaiser Permanente, and any doctors who've gone through the effort to opt out of Medicare, which is very, very rare.
Like it, good answer. The next one that I have here, and I'm going to ask this one first because I have a few more of them too that are asking the same thing. What's the penalty for not applying for Medicare when you turn age 65?
Yeah, so fair question. Most of you, it's very unlikely you have got late enrollment penalty exposure. But I'd be foolish not to give you the specific answer. So there's two late enrollment penalties you could be exposed to. one for Part B like Bravo and one for Part D like Delta. Part B like Bravo is, hey, you turned 65. You're supposed to enroll in Part B, otherwise there's late enrollment penalties. But as long as you have employer-sponsored health insurance from an employer with over 20 full-time employees, then you do not have Part B late enrollment penalty exposure. So as you can imagine, it's very rare somebody finds themselves in this situation, because if they don't have employer-sponsored health insurance at age 65, they're probably paying through the nose for individual and family coverage, and they're thrilled to go on Medicare the moment they're allowed, right? But let's just say you still missed it. It's usually not that person that misses it. Honestly, the person who typically, the two people who I find typically get late enrollment penalty exposure is small business owners, because a lot of times the oldest person at the company is the business owner, and they're just having fun running their business, and they go, I don't need Medicare, and they have less than 20 full-time employees, and then they continue on the group plan even though they were supposed to have A and B. And then for reasons I won't bore you to tears with, older husbands of school teachers. Okay, so wife is younger, she retires, because the only people who can afford to retire before 65 in this country are billionaires and school teachers, right? Because of the cost of health insurance. And then he turned 65 and he stayed on her retiree coverage, and then she turned 65. And yes, he was covered, but it wasn't from active employment. It was from retiree coverage. It was the same darn policy, but it just wasn't active employment spurring the coverage. And then he's exposed. So what does that penalty look like? Well, if the average minimum Part B premium is $175 a month, for every year that you went without Part B, you would have a 10% lifetime penalty. So let's say you missed Part B by a year. You're supposed to pay $175 a month for Part B. Well, now you're going to pay $175 plus $17.50 a month for Part B for the rest of your life. So it's 10% of the standard premium times the amount of years. That's the big one. And I'm not saying it's not a lot of money, but not going to change the course of your retirement. Part D, like Delta, so if you don't have drug coverage, in the interest of time, I'm going to tell you, it comes to about $5 a month for every year you went without Part D drug coverage. So nobody wants to pay penalties, but they're not awful. But, you know, people don't want to pay penalties. So you want to avoid paying them. It's very easy to avoid the penalties for most of you. So I guess that's a long way for me to just say a lot of the stuff that you get in the mail trying to scare the stuffing out of you. Is it possible? Yes. Is it probable? No. But, you know, of course, if we thought you had any late enrollment penalty exposure, we would certainly, you know, let you know, but we don't have to make those phone calls very often.
The next one I have, this gets to long-term care. And many people think that Medicare will pay for long-term care. Will it? And if so, by which part?
Yeah, good question. The only argument that could be made, and it's not a great argument, that there's an overlap between Medicare and long-term care is skilled nursing. So understand that skilled nursing is like the most expensive type of long-term care. It's basically a hospital with a lot less doctors, right? You're there to rehabilitate. And Medicare Supplement, Medicare Advantage, they'll cover up to 100 days of skilled nursing, which is great because that's the most expensive type of care. Two things I want everybody to really keep in mind is, one, if you ever have a long-term care event, it's probably going to be longer than 100 days. And number two, skilled nursing is the last type of care you're going to want, not the first, because everybody wants to be at home. So there's definitely going on to Medicare is not a long-term care plan. I would have a separate discussion with the folks at BFSG on how to manage those risks.
Okay, so the next one I have, and if you have a retirement account, right, be it Fidelity, Schwab, Principal, wherever it might be, will that raise that cost of $175 per month?
No.
Oh, sorry. Go ahead, Paul.
Yeah, so I'll take having a retirement account or any investment account doesn't necessarily increase that $175 per month. As you retire, if you start taking income out of those accounts, if they're tax deferred, you're creating a taxable event that can increase your taxes. But the short answer is no. You should be fine unless you're taking huge withdrawals out of those accounts once you retire. it shouldn't necessarily impact that too much.
And just because I think it kind of tallies on it, there's a question on it, like how do RMDs, when somebody's required to start taking distributions from their accounts, it might impact this?
So RMDs start at age 73. Um, depending on when your age, 73 to 75. But when RMDs start, that's the amount that the IRS requires you to take out of those tax deferred accounts. That money that's never been taxed, like your 401k, for example. Those will just increase your income. So the first distribution is around 4 to 5% of the total value. So if you have an account value of $100,000, you're going to be required to take out like 4 or 5,000. So it's not that big of a hit. It will slightly increase your taxable income when those RMDs start.
Right.
The
And
next
not,
one,
oh,
sorry,
go ahead,
go.
I'm sorry.
No, keep going.
Well, I would point out, just because I did see it in the chat, and I feel like if we don't address it, the person who asked it might be frustrated if we don't address it. I know these days Roth conversions are pretty popular, and Roth conversions, you just want to keep in mind, will contribute to your modified adjusted gross income.
Yes.
So, and they're kind of creating these forced or voluntary liquidity events. There's amazing tax benefits, and nobody's better at figuring out the trade-off on when and why Roth conversions make sense than Paul. But just, yeah, keep in mind that, you convert
It will trigger
100,000.
IRMA. So if we're helping a client with Roth conversions, we look specifically at that IRMA cost, because as far as I'm concerned, that's another tax you're paying. If we're increasing your cost for Medicare, it's money out of your pocket. It's the same as paying taxes. Then we got to look at other things too, like net investment income tax and a few other taxes as well. So doing a Roth conversion is easy, but it's difficult to calculate how much to do without triggering additional fees or taxes that you may be unaware of.
So before I leave the RMD thing, do you have to fill out form SSA 44 for each RMD?
That would not be a one-time liquidity event. That's once the RMDs start, you have to take those each year. So that's not a one-time event. Your income is going to be increased each year by those RMDs going forward. That form is really for a one-time event like selling a business, selling a home, stock options, things like that aren't going to occur again in the future.
Right.
So the
Yeah.
next one, oh, go
Go
ahead.
ahead.
So the next one I have is, this is going to combine two questions that have a bunch of votes. That would be number one. That gets to you, if the government pays 80%, am I responsible to pick up the other 20%? Kind of merging that with another question is, I mean, will they cover 100% after the cap is reached, or is it just 80% across the board?
Yeah. Well, if you just signed up for A and B and you did nothing, then yes, you would pay 20% of your medical bills in perpetuity. Now, look, 80/20 is not so bad. The problem is that 20% exposure is uncapped. So really nobody does nothing, because one of the insurance options, Medicare Advantage, costs nothing. So it's, very, very, very rare somebody would just do A and B and not choose a Medicare supplement or a Medicare Advantage plan. And like I said, Medicare supplement has a monthly premium. Medicare Advantage has no monthly premium. So there's just really no circumstances where anybody would ever find themselves paying the 20%.
No, those plans kind of pick up where the A and B leave off is where Advantage and Supplement kind of start to help
Right.
pick up that difference.
Yeah. And then to answer the second question, Chad, if somebody did a Medicare supplement plan, so Medicare paid 80%, the supplement pays the other 20% after you've paid your $240 deductible. Yeah, there's no more bills for the rest of the year on anything. You'll still have medication copays because that's different. But for medical bills, Medicare paid 80, the supplement pays 20, as long as you've already met your $240 deductible. And on Medicare Advantage, you're just paying your copay up to the max out-of-pocket limit, but the max out-of-pocket limit is very difficult to get anywhere close to that number, like unless chemo, radiation, or dialysis.
So the next one, we could probably go pretty quick. I think we've answered it a few different ways in it, but it came in pretty early. But just to answer it directly, if I turn 65, still covered under my spouse's medical plan, do I need to sign up for Medicare, or can we wait till both of us are retired?
You can wait till both of you are retired, as long as your spouse's plan has 20 full-time employees or more. You're fine. Every year, once you turn 65, your employer-sponsored plan or your employer should be sending you a letter to just say, hey, We understand you're over age 65, but we want to let you know that the plan that you're on is considered creditable coverage under Medicare, which is their way of saying you're not exposed to late enrollment penalties. So yeah, very common that, if your spouse has coverage and the employer is not, pulling a ton of money out of their paycheck and it's decent coverage, stay on the employer plan for now.
I mean, this next one came in really early. I think you talked a lot about it, so we keep it really high level. But can you kind of briefly cover the benefit cost of Part G again?
Yeah, so Plan G it's the top Medicare supplement option. It's not the only option, but literally Medicare pays 80%, Plan G pays every dollar of the other 20% less your $240 deductible. So you've got a monthly premium. The only time you reach into your wallet is the first $240 bill that you incur every year on Plan G. You'll pay for. Once you pay the $240, you can leave your wallet at home. And then also keep in mind you don't need referrals, and there's no networks. And there's no networks, there's no cost difference between doctors. I don't even know if it would matter if there was a cost difference between doctors, because your total exposure out of your pocket is only $240. So Plan G is like checking the box. I mean, it has a monthly premium, but it's checking the box, pretty much totally on medical bills, other than your first $240 bill.
And so the next one, and this came in again like 20 minutes into the whole thing, but is 635 the most someone would pay? And maybe that's attributable to premiums, not the 20% difference, but
I think they're talking more about the Part B premium and the IRMA premiums. It'll cap out. It changes every year. It can get up to $675 a month. So that's the highest amount right now. Every year things kind of get jiggered around a little bit, but 675 is the top. But I usually bring up 635 because, like, for a married couple, once if your income 2 years ago was over 386,000, you're at 635. If it's over 750,000, it's 675. So pretty much all the damage is done over 193,000 single, 386 joint. So I usually give you that number. Instead. So, but yeah, I can go to 675.
and then so next one is, I mean, any thoughts on Plan N?
Plan N is just one step below Plan G, right? So if G is great, N is nice. Again, I give you Plan G as the bookend, okay? But there's definitely other options. So remember, Plan G was covered 100% of the 20%, less at $240. Well, Plan N, same thing, covers the 20%. You still have the $240 deductible, but now you're paying $20 every time you go to the doctor. Well, obviously, if you're going to let the insurance company reach into your pocket or make you reach into your pocket when you go to the doctor, the monthly premium comes down a little bit. Doesn't come down a lot, but it kind of depends on your age, on your geography. Sometimes there's meat on the bone. But Plan N is just a little bit cheaper than Plan G because now you have $20 copays. If you don't go to the doctor a whole lot, it could be really good math. And, you can, there's levels below that you can say, if we can reach into your pocket faster, the monthly premium comes down.
The next one is, what about people that need dental and vision coverage? Do any of them cover this?
So Medicare on its own does not cover dental and vision and podiatry and hearing aids. On Medicare supplement, if you want that, it's a la carte. So we're going to go buy a vision plan, a dental plan, that sort of thing. Medicare Advantage plans will often include a lot of those benefits. Pretty much every Medicare Advantage plan will have enough of a vision benefit that you don't need to buy vision insurance. Look, the best vision insurance on the best day stinks anyway. So if they give you something for free, just take it. And then Medicare Advantage plans might throw in a dental plan as well. This might be a good opportunity to just explain why Medicare Advantage plans have no monthly premium and offer things like dental. I'll do this quickly, but that's a common question. So far, what we've covered, you should be expecting Medicare covers 80%. Part C is an insurance company covering the other 20%. Part D is for drugs. That is the way it works. But on Medicare Advantage, yes, they're covering the 20% that Medicare doesn't. Yes, they're giving you drug coverage. They're also taking over the 80% responsibility from Medicare. So let's say you go into a Humana Medicare Advantage plan. Humana is going to take care of the 80%, the 20%, and the drugs. And Medicare goes, hey, this is great. This person's on Medicare Advantage. We don't need to worry about paying for 80% of their bills anymore. Humana is going to do it. So the Medicare starts paying the insurance company, let's say Humana in this example, like $800 or $900 a month to take care of you. And there's enough meat on that bone to cover the 80, cover the 20, cover the drugs. They have to spend like 85% of the money on you. So if the cost to provide you insurance is less than what they're getting paid by Medicare, um, then they have to find ways to spend it on you. So here's a vision benefit, here's a dental benefit, that sort of thing. So using a Medicare Advantage plan, you're not paying them, but your choice to use that plan, you just directed like $10,000 a year of revenue from Medicare to Humana in this example. So it's just like a charter school, Chad. Like kids don't pay tuition to go to a charter school, but every kid that walks in the door, the government pays the school to educate that kid. Now that kid's all grown up and they're 65 years old and they walk in the door to the Medicare Advantage insurance company and Humana tells Medicare, hey, this guy just walked in the door, we'll take all the risk and we'll manage the whole thing, but you got to pay us, $800 or $900 a month.
So the next one is, and this came in, around 1040, is I thought Medicare Advantage was an HMO type plan. Is Medicare Advantage PPO plan true for all areas in the United States? There's another question kind of saying or is it like more like a combination plan?
Yeah. So historically, way back when Medicare Advantage plans were mostly all HMOs, now virtually, it depends on your county, right? But I'm going to say in most major metropolitan areas, there's tons of PPOs now. And then even in rural areas, HMOs don't work very well because the medical groups are not big enough. So you need the flexibility to kind of, bounce around the county to see specialists. So PPO Medicare Advantage plans are way more prevalent than they've ever been before, which again, kind of means it used to be polarizing. No monthly premium, but it was an HMO Medicare Advantage plan. If you wanted a PPO, you had to pay that monthly premium for a supplement. Now you kind of have like Goldilocks's porridge right in the middle, which is the Medicare Advantage PPO plans. They're a PPO, so they satiate most, if not all, of what you wanted from the supplement, and they have no monthly premium like the Medicare Advantage HMOs. So, yeah, so the PPO Medicare Advantage market's just getting bigger and bigger. So very, very abundant options in most areas. It would depend. I probably have to know who the person is and what county they're in. But right now, I feel pretty comfortable saying there's probably some very good PPO Medicare Advantage plans wherever you live.
Okay. Next one, I'm merging a couple questions together again, just because it would be at the top of the list. Did you say that Plan G costs $150 to $204 per month or annually? And then beyond that, somebody else says, doesn't Plan G have a $2,800 deductible this year, not $240?
So Plan G, in most parts of the country at age 65 costs about $150 a month. Okay. It's paying $150 a month every month. Okay. And really the only time you're reaching into your pocket is the first $240 in bills that you generate. You have a $240 deductible. So you just pay $240. So it's $150 a month plus the cost of your Part D drug plan, right? So that's the way Plan G works. What the other person was talking about is high deductible G. So if Plan G is, again, I gave you that as the bookend. That's let's say the most robust and also the most expensive option at about $150 a month. The least expensive Medicare supplement option is a whole bunch of letters in between. The least expensive would be high deductible Plan G. Now, high deductible Plan G costs, $40 a month. It's cheaper than 150, right? But what happens with that is Medicare is paying 80%. You're paying the 20%, which is okay, but you're paying the 20% until your share of that 20% has reached 2,800, which probably means, Chad, you've spent $11,000 or $12,000, on Medicare allowable expenses, right? But once your share of the 20% reaches 2,800, then it behaves like normal Plan G, and then you don't see any bills for the rest of the year. So, monthly premium is way less, but you're just paying $20 copays throughout the year. And then once your 20% share reaches 2,800, then you're done with the bills. So that's the other end of the Medicare supplement spectrum.
Great answer. Next one I have, and this just might be something to opine on. I've heard it can be hard to get appointments with the Medicare Advantage plan. Any insights on how to get in there?
That's it's a valid question. That's more of an
HMO.
that's more of an HMO issue. Okay. Because HMOs, you got your primary doctors like your quarterback. He or she's going to send you to their home team specialist. And you have to go where they tell you. Now, if you're in a major metropolitan area, being limited to one medical group's probably not very limiting, but let's be clear, you're not hopping over to Albuquerque for a second opinion because your buddy Chad told you to go to his knee guy instead of, yours in Orange County, right? The other thing to keep in mind outside of HMO, and this is good for anybody with grandkids, is what no Medicare plan or health insurance plan fixes is the fact that darn near every doctor in the country is ready to retire right now. So there's capacity issues, and it doesn't matter whether you're on a Medicare Advantage plan or Medicare supplement plan. If that doctor is booked out for 4 weeks, the doctor is booked out for 4 weeks. So tell your grandkids, go to medical school. I mean, it's so often, Chad and Paul, when we're gathering information, it's okay, here's your primary doctor. And the people say, well, it's Dr. So-and-so. And they pause 1001, 1002, and they go, oh, but she's about to retire. Okay, well, who's your dentist? Well, that's Dr. This and that. But she's about to retire, right? I mean, it's really an issue. So there has been a push towards concierge medicine, which costs money, but then the doctor limits the amount of patients they'll handle. But that, I think that's more of a demographics thing than anything else. But HMO plans would certainly not help that situation.
Yep. And just because I'm getting a lot of questions, still going back to penalties, and obviously penalty is a big word that nobody likes. If somebody turns 65 and do they need to enroll even in Part A or B to avoid penalties, or can they enroll even if they still have coverage with their employer, stop their employer's coverage, but then enroll in like the supplementary stuff later, right? Like, how does all that work with this group?
Can I?
Yeah.
Let me answer this one real quick, Brian, and then you can add to it.
Go ahead.
Look, if you're 65 or fast approaching 65, talk with a professional. Everybody's situation is different. Everybody has different factors to consider. Like, are you doing an HSA or not? What's your cost that you're paying versus what the cost you'd be paying on Medicare in your area? So have a professional that can do the analysis with you to help understand your individual situation. It's very hard to answer this holistically for everyone, giving everybody the right answer.
Yeah, and I always, unfortunately, they keep this stuff just complicated enough. I always know I'll have a job tomorrow, which is a terrible thing to say out loud. You're grateful for, but it's the answers get clearer on a more individual basis. I would never dismiss anybody asking a question. That's what I would do as well. But so much of what we do is just turn a complicated topic into something simpler and just help you realize, okay, out of this big universe, here's your path, here's your options, here's what you do need to worry about, here's what you don't, but that being said, I'll ask answer as many as we have time for.
So the next one is, if somebody's on their spouse's employer's plan, can they switch to Medicare while their spouse stays on their employer plan?
Yeah, totally. Matter of fact, one of the things I tell people is, again, we don't want to be, Medicare is great, right? But again, some people have decent coverage. They like their plan. They or their spouse don't pay a whole lot for it. I even tell people, you can stay on the employer plan or your spouse's employer plan. But the other thing that I think really makes people feel at ease is, even if right now you just go, hey, Brian, Medicare sounds great, but my employer coverage or my spouse's employer coverage is pretty good right now. I tell them, look, we can actually put you onto Medicare any month in the future once you've turned 65. So we don't even have an election window. So an example I give is, look, if staying on your employer plan or your spouse's employer plan once you're 65 feels best for now, then do that. Maybe you have a $4,000 deductible that you never hit, right? Because you're probably just doing a doctor's visit, specialist, labs, right? And there's that boogeyman that you see. There's a $4,000 deductible. You're always worried about it, but you never hit it. But I can tell you, if you're in that situation, if suddenly you need hip surgery or knee surgery, you're probably going to hit the deductible. So I just say, look, stay on the employer plan if that's what feels best now. And this doesn't work for emergencies, Chad, but if you need to get your hip done and you do a little poking around and you go, oh my goodness, I'm going to write a $4,000 check for this knee surgery. Don't call me up the day before your surgery, but if you call us up 60 or 90 days ahead of time, we can, as long as you're over 65, we can put you on Medicare right before your surgery, and your $4,000 deductible turns into a $0 deductible or $240 deductible. So people who are working past age 65, they really have a lot of autonomy. Stay on the employer plan. If it feels right, then do that. Stay on until you retire. Then we'll put you on Medicare, but we can also put you on Medicare anywhere along the way if that was better math.
Okay, so this next one, I'm going to swing it to Paul. Brian, check your messages. I know we're at the bottom of the hour. I want to be respectful of your time too. Paul, I would differentiate maybe the difference between accounts and starting to take distributions, but do I need to sign up for Social Security prior to signing up for Medicare? And I say specifically, the question says a Social Security account, and I feel like probably you need an account because you take Medicare through that. That doesn't mean you need to start taking Social Security.
So when working with the Social Security Administration, you can do it in person, online, or over the phone. I would recommend everybody sign up for an account with Social Security for a couple of reasons. One, like Brian said before, if you're working with someone like him, they can help walk you through getting logged in, getting inside, making your elections through socialsecurity.gov is the website to do that. But you would need to have that account set up beforehand. But secondly, just from a Social Security perspective, they release statements each year showing you what your projected benefits are going to be. So it's great just to make sure those look correct as well, or just to get that information. So it is good for everybody to have an account for Social Security. And again, the website is ssa.gov.
Cool. Next one I have here. Oh, go ahead. Sorry, Brian.
I was going to say, matter of fact, when we're helping people enroll in A or A and B on through their ssa.gov portal, we always say, hey, I'm sure Paul wouldn't mind an updated copy of your Social Security statement. Paul's pretty darn thorough, so he probably already has it. It's not like it changes a lot year to year. But, I always joke around Paul and say his free gift from a financial planning standpoint is an updated copy of the client's Social Security statement as a result of helping them enroll in A or A and B.
So the next one I have here, group, and I think it's a few people have asked for it too. So what would a supplemental cancer policy look like? Like, I mean, is there like a particular letter or something like that goes beyond Medicare?
Yeah, it's not a letter. It's they're just kind of called, there's different cancer indemnity policies, cancer, heart attack, and stroke. They all kind of trigger on different events. You kind of get what you pay for, right? I mean, if it's it could be $30 a month, it could be $50 a month, could be $60 a month. We use those where appropriate. I don't personally do well with a bunch of surprise 4-figure bills, so I tend to have, sometimes policies like that in different areas of my life. There's extra costs associated with cancer. So having 10 or 20 or $50,000 dropped in your lap to kind of mitigate that can be helpful. But, there's no utopia. There's trade-offs. We look at the cost for the insurance and try to figure out if it's worth it to buy that or self-insure. So, I don't have the numbers handy, so otherwise I would give you an example. But if somebody was interested in that, we would just look at the math and figure out if it makes sense.
So next one, and then this is, I think, a great one. What kind of things have you seen people just be surprised from that Medicare didn't cover? I think this question specifically mentions hearing aids. I think you already addressed that, right? It doesn't do like dental and vision stuff like that. anything that's just surprising that people should be planning for?
Well, yeah. So like I said, dental, vision, podiatry, hearing aids, right? So, um, Medicare Advantage plans may include some of that coverage. Medicare supplement plans you might buy a dental, vision, hearing plan. A lot of it has gone away. The big gotcha that used to happen that no longer happens was the shingle shot because Medicare does not cover vaccinations. Most vaccinations don't cost a whole lot, but the shingle shot was kind of expensive. So I'd have people on like Medicare supplement where they just never, other than the $240 deductible, never saw a bill, and then they get whacked a couple $100 for the shingle shot. But that used to be the outlier, but now Medicare actually covers that. And then the other outlier was out-of-pocket drug costs. Now, the Inflation Reduction Act is being phased in January 1, 2025, fully. It's partially phased in now. And there's a blessing and a curse. There's never been a max out-of-pocket on Medicare Part D. That sounds scary. In reality, cancer is the most expensive meds. And clients that we've had who were dealing with cancer, if they're on expensive meds, they would pay $7,000 to $8,000 a year for their meds out of pocket. That's no small sum of money. I mean, that's for like $150,000 retail. Nobody's paying $150,000, but that's about, even without a max out of pocket, it would cap out at about $8,000. Well, now there's going to be a $2,000 max out of pocket limit on Part D, which if you're paying more than $2,000, you're probably going to benefit from that legislation, right? The other issue is there's 68 million people in the country on Medicare. There's only 2 million of the 68 million are currently paying over $2,000. So that's who would stand to benefit from the legislation. The other challenge is that when Medicare meds get really expensive on Medicare, when you get into the catastrophic phase of Medicare Part D, I'm not going to explain that in detail right now, but that's when things got ugly. Medicare used to pay 80% of the retail cost when people got in that situation. Now they're going to pay 20% of the retail cost. So the Inflation Reduction Act says, hey, you can only charge this person $2,000 a year at the counter, capping how much money the insurance company can ask the client to pay. But in the same exact breath, Medicare is saying, oh, and when this gets really ugly, you used to count on us to pay 80% of the bills, you're going to pay 20% of the bill. We're going to pay 20% of the bill. Well, anytime legislation affects an entire industry, all that happens is that the cost of that legislation gets pushed onto the consumer. So regardless, I'm not trying to, pick legislation apart because you could make this argument for any legislation. It's going to be clunky or have some loopholes in some ways. The messaging on the legislation is, hey, we're going to make the insurance companies and the manufacturers pay their fair share. They're going to pay almost nothing for the legislation because like a Part D drug plan that I told you is $30 a month next alongside a Medicare supplement. It's kind of early, but I will not be surprised if the cost of a Part D drug plan goes from $30 a month to $60 a month, because the insurance companies are just they still need to make the math work, and they're just going to push the cost of this legislation onto the consumer. Additionally, you're probably going to see some formularies shrinking. So if there's two competing medications that let's say there's no generic, so they're both brands, they compete against each other. Let's say there's no difference in uses, right? So this might be a smaller universe, but still the cheaper drug is going to get dropped off the formulary, because let's just say the margins to the insurance company are 20% margins on a medication. They need to make this math work, and they're going to say, well, do we want to earn 20% on an expensive medication or 20% on on the less expensive competitor? So the formularies are going to shrink. So this year in particular will be a lot of disruption when in September, when people get their annual notice of change that says, here's what your plan did in 2024. This is what it's going to do in 2025. Nobody ever reads it. Everybody needs to read it this year, because you need to kind of see how this impacts you. And, we're prepping it's going to be an insane year to kind of tell people, well, you can improve that by moving, or hey, you can't improve it by moving because everything's going up, So long answer to your short question, but the good news is the out of pocket drug costs are capped at 2,000. So that wild card that used to go up to 8,000 is no longer really an issue, but the consequence of that is the monthly premiums are going to go through the roof.
Yep. So the next one I have, and again going to merge a couple here, but I think for somebody who's over 65, already signed up for Part A, still have their employer plan. Yeah, at first, can you kind of go through the process just to enroll further in Medicare as they move to more semi-retired and may not be eligible for their current like employer coverage? Then beyond that, for somebody that might still be eligible for current coverage, any insights into when their current employer coverage might be more beneficial than Plan G?
Yeah. So addressing in order, let's just say, I think that person said they already had Part A, or we're assuming they had Part A. So they applied for Part A through the Social Security Administration. They've got employer coverage. They got Part A floating around in the background. Now they decide, Brian, I'm ready, or Paul, I'm ready to retire, right? So 90 days prior. So usually if you work a day into the month, your employer and you're retiring, you're like if you worked until July 8th, your employer is probably going to give you coverage through July 31st, which would mean we need Medicare to start August 1st. So hopefully the person's calling me, 60, 90 days out. And then from there, I would show them how to apply, or a member of my team might show them how to apply for Part B. There's a form you get your employer to fill out that says, hey, leave this nice person alone. They've been covered by us from age 65 to now. You take that form, you fill out a Part B application, takes you 10 seconds to fill it out. You slap it together, fax it or mail it to your local Social Security office, and now you've applied for Part B. 3 weeks later, you get your new Medicare card with A and B on it. Now you're ready to choose a Medicare supplement plan. So if they already have Part A, we usually need paperwork to apply for Part B. If they're going on to Medicare A and B at age 65, we can do all that online. So we just, whatever is easiest is what we guide them to do. And then I'm sorry, the second question was what?
Is there any point where staying on your current employer's plan might be more beneficial than Part G?
Look, Plan G is going to be better than any employer plan, hands down. There's just nothing better. All right. But do you still want to look at the cost, right? If you have a really generous employer who takes $100 a month out of your paycheck and you're not complaining about your plan, stay on the company plan for now. That's totally okay. I think it really just depends if you're happy with the plan, or if you're not sure if you're happy with the plan, you send us a summary of benefits, and we just say, okay, well, these are the benefits and this is what they pull out of your paycheck.
Yeah.
And then, we can kind of create more of an apples to apples comparison, and, whatever feels best for you is what you should do. And like I said, if you have employer coverage, if it just hit us between the eyes that, oh my goodness, you should go on to Medicare right at age 65, even though you have employer coverage, that's usually not our conclusion, but it can be. Yeah, you could do that, but you could also stay in the employer plan and we can put you on Medicare anytime in the future. So it comes down to summary of benefits in your current plan and let us know what they pull out of your paycheck or your spouse's paycheck. Some employers also charge you disparately. So, it might be $200 a month per spouse for health insurance, the group plan. It might be, some other plans charge the employee nothing, but then they charge you through the roof for a dependent, right? So those are the things we want to find out. What are you paying versus what are you getting? And we say, well, this is the way it would look on Medicare. And, whatever is best will probably become apparent to everybody all at the same time. So we don't force any outcomes. It's just about weighing the trade-offs and, whatever, once you understand the trade-offs, whatever feels best is probably what you should do.
So the next one, this gets to just, the overall cost between different parts. A few people just kind of doing the mental math, right? Part B, 170, supplemental C, 150, D, 30. So are we looking at total bill of 350?
Yeah.
Mental math seems right?
Right.
I feel like there was an area, because I do have another question in here. It hasn't been getting the nearly the love, but you made a comment about zip code. So Why do they use zip code, and like which of those numbers might boost it above 350 based on where somebody might live?
Um, well, okay, so one of the things that could boost it above 350 is whatever your Part B premium is, which doesn't matter on your zip code. Again, that's all tied to your modified adjusted gross income. So if you have higher income, that's going to push up your Part B premium from $175 a month to up to $635, like we covered, right? That's all based on Medicare, just looking at your tax return. Um, zip codes. Um, Zip codes will affect or can affect the pricing of Medicare supplement plans for the most part. It doesn't really affect Part D drug plans and doesn't really affect Medicare Advantage plans. But, like I said, broad brushstrokes, age 65, Plan G, most areas of the country, maybe about $150 a month. Um, Minnesota is probably about $280 a month because they price it differently. They charge everybody the same. So whether you're 65 or 95, everybody pays the same amount. Um, so um, so Minnesota costs are really high. Florida costs, not in every county, but Florida costs can get kind of up there. I mean, there's a lot of people in Florida, a lot of people on Medicare. Um, but I think really what it's about is the claims, right? So there's a lot of people running up big medical bills in Florida. So, and they just base it on the residential zip code. So,
So if you live, expanding on that, if you live part of the year in one state, part of the year in another state, would your premiums potentially change, or is that based on where you live a little more than 6 months and say a resident?
yeah.
Any,
So good question. I shouldn't give you the answer I'm about to give you on a recorded Zoom, but, the, a lot of people have a second home in a zero income tax state, might be Florida, Texas, something like that. Um, and, you're really supposed to submit the application with the physical address to where you're going to file as a state resident. How convinced am I that the insurance company checks the accuracy of that? Because a Medicare supplement plan works identically across the whole country, right? So if you have two different residential zip codes, there's an inclination to use the zip code that has the lower Medicare supplement premium. Um, and honestly, it'll work identically, regardless, because Medicare supplement plans just work identically across the whole country. Every once in a while, like United Healthcare, I've seen them do some poking around and say, well, you say you live in this zip code, but we checked and Social Security has this address. So we're going to move you to that. I think the insurance companies, some of them are more aggressive at checking into that. Some of them are not. I would never want to promote anybody do anything that's not truthful, but I guess at the same time, if you have two houses, it's like, if you think you can say with a straight face that you live in this one area, then so be it, right? But ultimately, you're supposed to use the physical address at the address where you're going to file, residency on your tax return. I think that's really the barometer
Yep.
to go with. And if people, I don't even want to say want to get loose with it, but people's plans on how many days a year they're going to spend in every home. I mean, maybe it's fixed, maybe it's variable. So I don't know. I'll leave it at that.
Yep. And so the next one, I think this is one a lot of people eventually face at some point as they go through retirement is, if a spouse has a pre-existing condition, right, heart disease, cancer, et cetera, right, any recommendations for those looking for some of these big procedures, right, bypass surgeries, chemo, MRIs, CAT scans?
Yeah. So good question. I mean, I'm going to say in general, like I said, Medicare supplement, Medicare Advantage, both great news. If you already had some pre-existing conditions, I would probably weigh the guaranteed acceptance into the Medicare supplement a bit more heavily because, you know, you might already know, hey, Medicare Advantage is great, but if you know you're going to have surgery, stay in the hospital, you're going to run up some bills. They're not going to be awful bills, but let's just say that those bills get to the point where you go, well, gosh, had I just had a Medicare supplement plan, I would have paid the monthly premium and I just wouldn't have even worried about anything. So, the more pre-existing conditions you have, the more that you might weigh that guaranteed acceptance into the Medicare supplement more heavily, and take that bird in the hand. You can always start with Medicare supplement, take the guaranteed acceptance and then, I have people that do that because they just go, Brian, that's just what makes me feel best. Great. And then, it's kind of up to them. But during that open enrollment season, they can say, well, tell me about those Medicare Advantage PPO plans again. You can always go from a supplement to Medicare Advantage, no questions asked. And you can go from you can actually go from a supplement to a Medicare Advantage plan if you've never been on a Medicare Advantage plan, and you get a 1-year round trip to come back to your supplement, no questions asked. So that's a one-time 1-year round trip. If you're on a supplement and you want to try out Medicare Advantage for 1 year, you can come back. Some people do, some people don't. But if you went from Medicare supplement because you just took the guaranteed acceptance because of these pre-existing conditions, and maybe you navigate those and you go, well, I don't really go to the doctor as much anymore, I'm not as worried. You go Medicare Advantage PPO, you can always go there. And but I would say the more health issues you have, the more you'd weigh the guaranteed acceptance into the supplement a bit more heavily.
Got it. So the next one is, does Part D have the same kind of like donut hole caps, right, that Advantage Plan has related to expensive prescriptions?
I'm sorry, can you ask that again?
Like, does Part D have like a bunch of caps, right, that the Advantage Plan has related to expensive prescriptions?
I think you're talking
No.
about the donut hole.
Yeah, I'm sorry. Go ahead, Paul.
No, I think you're talking about the donut hole.
Yeah, the donut hole is going away January 1, 2025, because the Inflation Reduction Act is basically eliminating it. And the donut hole is where things used to get ugly, right? Where you thought you knew what your copay is, and now you're paying more. So like that example where I told you people with cancer paid $8,000 for their cancer meds. Most of that $8,000 was realized in the donut hole. Donut hole is going away, which is great. Max out of pocket, $2,000, which is great. Again, there's going to be other ways that people pay for it, but the other thing that's going to happen is it's going to be way easier for people to get to that $2,000. So the insurance companies are going to start pulling money out of your pocket much faster to get you to that $2,000 max out of pocket is my prediction. I'll have visibility on 2025 plans after October 1, but just by looking at the math and talking to some industry insiders, that the big out of pocket costs that you'd worry about in Medicare Part D will not be an issue, but as a result, the cost of providing that coverage on a monthly basis is going to go through the roof.
So this next one is, I think, just somebody looking for advice. They registered and they didn't receive their card from Social Security Administration. Any advice, or do they need it?
Usually takes about 3 weeks from the point that you apply. Could go 4, right? The other thing that you could do is if you log into your SSA.gov account and you download your benefit verification statement, if you've been given a Medicare number, it'll be there. Basically what that benefit verification statement says is, hey, Chad Narani is or is not on Social Security. If he is, this is when he started. He is or is not on Medicare. If he is, this is his Medicare number. This is his Part A start date. This is his Part B start date. So if they've processed that application, then you might find that information in benefit verification letter before it shows up in the mail. But it's usually 3 weeks. I guess it's safer if I say 4 weeks, but it's unlikely it'll be more than 4 weeks.
And the next one, we did a lot on HSAs. What if somebody has an FSA or flexible spending account? Do they still need to stop those contributions?
Good question. No, those are not affected the way that health savings accounts are. So flex spending, contribute, and spend to your heart's content.
Yeah. And the next one is, like, part of it is, can we talk about the Kaiser Medicare option, right? Is it an Advantage choice? But also that if this person's heard that Advantage plans aren't great because they often deny authorizations for procedures. If they're operating as PPOs, like how can they even do that?
Yeah, so this past year, there's been some more press about Medicare Advantage. Because we at design at my firm, we basically work exclusively through the financial advisor community. So like we transact more Medicare supplement than anybody I know. I still stay agnostic and lay out because the merits of both. But I haven't seen any of these horror stories. It doesn't mean that that anything you saw in the news doesn't happen, but I think there is kind of some. I'd validate some of it, and some of it might be kind of cherry picking events. But the only reason Medicare Advantage plans are allowed to exist is because Medicare allows them to exist, right? Because they're saying we're going to pay you to take our risk. There was definitely some cases of insurance companies squeezing on the claims. It's just not something I've really experienced, which doesn't mean that the buck stops with me. I mean, for whatever it's worth, that I have several hundred people on Medicare Advantage plans. It's a large sample set. Is it millions? No. But if everything we do has to reflect well on the financial advisors, if somebody gets a bad outcome, usually we're hearing about it. So I just haven't seen it. And even any attention that's brought to it is basically, Medicare has consistently, even the Senate Finance Committees, putting their thumb on the Medicare Advantage insurers and saying, we told you if we pay you this money to take our risk, you need to provide coverage that's at least as good as what we offered. In a lot of cases, Medicare Advantage might be better in certain ways, but there's a lot of attention on it as a result. So I would expect less of those stories than more. The other thing I would say with like the Kaiser dynamic, and again, forgive me if you're in a place, live in a area of the country where you're not familiar with Kaiser Permanente, but kind of in the same way that every Kleenex is a tissue, but not every tissue is a Kleenex, but every tissue you call a Kleenex. Kaiser Permanente is like HMO, right? They're like the poster child for HMO. They've got big medical groups. It's an HMO. Also, the only way to get treated at Kaiser Permanente is to buy an insurance policy from Kaiser's separate insurance company called Kaiser Permanente, right? So you can't own United Healthcare and go to Kaiser. You can't own Blue Shield and go to Kaiser. You have to have the Kaiser insurance company to go to the Kaiser medical group. I am sure that from a compliance standpoint, that there's no conflict of interest when these medical groups have a separate sibling insurance company. What I can share with you, I'm not trying to be a tinfoil hat guy. So take this with a grain of salt. But for whatever my perspective is worth, sitting on the park bench watching thousands of people go into, Medicare every year. If a doctor wants to run a test and the bills are being paid by an insurance company that has some, let's call it sibling affiliation with their employer, I just worry that it's kind of like letting the fox guard the hen house. Now, I don't want to sit and accuse anybody of anything. So I think the better way for me to say this is that, I live in San Diego, California. So if I go to San Diego and I go to my doctor at Scripps and my insurance company, my Medicare Advantage plan is United Healthcare, my Scripps doctor does not give a rat's rear end about the bottom line of United Healthcare. If he thinks I need a test, he's probably going to, push to get it through, right? Where if the insurance company and the medical group are kind of part of the same family, I just worry that I don't want to say a word because I don't want to say anything that gets me in trouble, but I would hope that there's an exceptional amount of compliance to make sure there's never a conflict and that sort of thing. And I guess that's a way to say it. Now, full disclosure, just in the spirit of transparency, Kaiser Permanente's Medicare Advantage plan is like the only plan that independent agencies like us cannot sell. I mean, if we talk to somebody there at Kaiser, like we just walk through the trade-offs, and if they need to do, if Kaiser's would feels best, we tell them to do that. We wouldn't want to disrupt that. But in full transparency, Kaiser doesn't let independent insurance agencies sell their stuff. But I always like to dig in and find out, well, do you love Kaiser? Are you, no matter what life throws at you, are you okay solving that problem at Kaiser? Well, then you should do the Kaiser Senior Advantage Plan. If you could ever imagine wanting the autonomy to go somewhere outside Kaiser, I'm not even saying where, I'm saying it's simply a doctor in the country who's not at Kaiser. You kind of have to, because Kaiser is very polarizing. You're either all in or all out. There's not, PPOs don't work there. So it's just a decision people have to make.
Yeah, so I know we have crossed the top of the next hour, so do have people starting to drop. We have 5 questions if you guys are open to answer them real quickly in rapid fire,
Sure,
and
I'm
we'll
sure we've
call it
made
at
people.
least 5. So no new questions can come in, but we'll get through these ones that people have asked.
All right, go for it.
All right, so one came in. It was pretty early too. If I need daycare help, like would Medicare cover that? I don't know if that's for a child or an elderly dependent, to be fair.
Certainly not for a child. There are plans that offer some degree of home health care. I'm going to set your expectations very low. I know during COVID, a lot more home care started up, right? So they didn't have to expose people to unnecessarily. Any mention I see of home health care, I would set very modest expectations. And it's, if it's something that can be accomplished by somebody who shows up, I mean, if they can get the job done in 19 minutes, they're probably gone in 20. So it's not going to be extensive. It's going to be very closely related to health care that you need administered, and they're saving you the trip from going to the doctor or the hospital. So I'd set modest expectations.
So next one is this person's already on original Medicare with Medigap. Can they still call it self-refer to see any doctor or specialist and not join any network?
Absolutely. There is no networks with original Medicare. So, you could be asleep at the wheel and go to any old doctor you want. You could also chase down the best, left toe orthopedist for you. So you've got no boundaries. So you can call up any doctor in the country and, book an appointment.
So next one is, do we need Part D if we have a Medicare Advantage?
Most Medicare Advantage plans have Part D built into it. So as long as it's Medicare Advantage with prescription drugs, as long as you can look in the summary of benefits and it's got drug coverage, then that is Medicare Part D. So very rare. There's Medicare Advantage plans that don't have drug coverage. Those are really only built for veterans who like going to the VA, and but it's like the Medicare Advantage plan costs nothing, has no drug coverage. You're going to go to the VA for the most part anyway, and there's some other nice benefits in there, and they're usually a little bit nicer because there's no drug coverage. But the easy answer is Part D is built into your Medicare Advantage plan.
The last two. Next one is, it seems like the out-of-pocket cost for original is higher, right, than choice. Are there any cost advantages to original Medicare relative to Medicare Advantage?
Not sure I totally understand the question, but original Medicare with a Medicare supplement, let's just say you do Plan G. Again, I just give you that as the bookend. Your out-of-pocket maximum is basically $240. I think Medicare Advantage and Medicare supplement come a little bit more down to, do you want to pay a monthly premium every single month and then have virtually no bills? Or do you want to pay no monthly premium and have modest bills, but every time you go to the doctor, you reach into your pocket for a copay? So I don't know if I did justice to that one, but it's one's not a hero, one's not a villain. The copay exposure matters, but I think there's other things that I'd probably need to understand.
Yep. And I'd say, before I ask this last one, contact information is on the screen. Definitely feel free to reach out, email, phone call. We're happy to schedule time. And last one, I left it here. I mean, it doesn't have any thumbs ups anyways, but it goes back to penalties. We keep hearing about penalties over and over today throughout today's call and the Q&A. When would those kick in for someone?
I just thumbs upped it so that the person is validated. So, yeah. So, good question. Penalties are possible. They're not probable. But the only time you'd get exposed to penalties is if you turn 65, you did not enroll in Medicare Part B, and or D, and you also did not have employer-sponsored coverage. So it's kind of an unlikely scenario. So there are little nuances, but in general, if you don't have employer coverage, you're going to be chomping at the bit to jump on Medicare the month you turn 65, and you'll be thrilled because you'll probably get better and cheaper coverage. And if you're covered by an employer, overwhelming likelihood is that that employer coverage is protecting you from late enrollment penalties. The only time that they would show up is once you actually go on Medicare. Medicare goes, oh, there you are. Okay, well, we noticed you should have showed up here 3 years ago, and you're just showing up here today. And unless you can prove that you had employer-sponsored coverage that met minimum requirements, we're going to charge you a late enrollment penalty. So it doesn't happen. I don't want this to come out the wrong way, but you almost, obviously there's other circumstances. You almost need to be living under a rock to be exposed to late enrollment penalties. And in fairness, let me hold space for other people who just with good intentions, just like I said, small business owner, sometimes spouse of a retired school teacher or that sort of thing. But other than that, it's very rare.
Awesome. Brian, Paul, thanks for staying on so long, especially crossing 2 hours. Thanks for the attending. We still have a huge amount of the attendees. We're talking like over 30% of attendees are actually still on the line for this thing. As
Thank
we
you,
answer all the
attendees, for
questions.
staying on this long.
Thanks everyone for your time. Paul, can you click that disclosure so I don't get in trouble with our compliance team that we always need to end down here? Again, Brian, Paul, thanks so much for your time, and thanks for rapid fire questions. I hope you all have a great afternoon.
All right. Thank you.
Thanks,
for having me
everyone.
on, guys. Thank you, everyone. Bye now.